pressure. I'm going to keep it simple. I want to talk numbers with you. 2. That's how old our beautiful Kaitie over here was when she was diagnosed. Her birthday is on the 28th of February, which is Rare Disease Day. She was diagnosed with mucopolysaccharidosis type 1 Hurler syndrome. It is a devastating genetic disease that affects 1 in 88,000 Australian children. In the preceding 6 weeks, we had driven the 500 kilometres to Adelaide and back 11 times for the diagnostic process. 17. That's the number of different specialty doctors who monitor every aspect of Kaitie's fragile body. Some of those she sees includes a neurologist, cardiologist, ophthalmologist, orthopaedist, geneticist, rheumatologist, oncologist, pulmonologist, gastroenterologist, haematologist, endocrinologist, psychologist, metabolicist, ENT, specialist dental, as well as speech therapy, physiotherapy and occupational therapy. 22. That's how many general anaesthetics Kaitie has had for a total of 35 combined operative procedures in the last 7 years. From central line insertions or removals, adenoidectomy, bone marrow harvest and subsequent transplant, major dental work as a result of the pre-transplant chemotherapy, an umbilical hernia repair, a bilateral carpal tunnel release surgery age 6, as well as multiple ear tube insertions and more MRIs, X-rays, tests and scans than I can possibly remember. And I have been the one holding her down as they put her to sleep for all but 4 of those procedures, and it gets harder every time. 32. That's how many hospital admissions Kaitie has had. This includes a 3.5-month-long admission to Sydney Children's Hospital, over 1,000 kilometres from our home in rural South Australia, not Adelaide. The Women's and Children's Hospital in Adelaide could not perform the life-saving bone marrow transplant that Kaitie needed. As hard as putting our tiny girl through transplant was, it was much harder because we had no family there with us. 32 admissions, granted, is not a lot, but when you take into consideration that we spent more days in hospital than out in 2007, when you consider that so far we've attended the Children's Hospital over 100 times for 300 plus different outpatient clinics, the picture becomes clearer. 5. That's how old our son is. He also has a rare condition called asymmetrical cerebral ventriculomegaly. It is completely unrelated to what Kaitie has. We just got lucky. Separate to this, he also had a cholesteatoma, or a small abnormal growth removed from his middle ear space at 22 months. He also sees specialists in Adelaide. My husband has multiple sclerosis, diagnosed last year. This is a less rare condition, but one that also requires travel to Adelaide for specialist consultation and treatment. 31,000, approximately. That's how many dollars the Life-Saving Drug Program, or LSDP, paid for just 12 doses of synthetic enzyme medicine for Kaitie, pre and post-transplant. The 4-month-long bone marrow transplant process and all of her treatments to date would easily exceed $1 million. But this amazing little girl to my left is worth so much more than that. I'm so grateful for our healthcare system. There is room for improvement, and it's certainly not perfect, but without it, that little girl sitting there wouldn't be here anymore. 53,000. That's approximately the number of kilometres we have driven in the last 7 years for the sole purpose of hospital visits. My husband is a farmer, so there is no option to relocate closer to Adelaide. And so we will keep doing this. We will keep driving, we will keep attending appointments for as long as we have Kaitie with us. And if she were your child, you would do the same. Thank you.